This is Schizophrenia Matters, and today I'd like to talk about what it is like to have to take antipsychotics. I'm only on one medication right now to control all my symptoms, and it works pretty good, but I definitely am free of delusions, I'm free of most hallucinations, and I'm free of my thinking is less scattered. Even though that I do have some of that scattered thinking and repetitive thinking and repetitive actions as a result of my last episode. I think I have some cognitive impairment that just like the medication is just not going to touch. It's burnt in. But anyway, I have to work on those things, like I pace. It's one of those cognitive disorders that I have. Since my last psychotic episode, I pace, and it's a repetitive behavior that I have, and so I wish that the medication would take care of that. Another thing that the medication does is weight gain. I really wish that I didn't have to work so hard to lose weight. I'm losing weight right now because I gained so much weight initially. I feel like I look pretty okay, I'm pretty tight in the face, and I've lost a lot of weight. I lost about 10 pounds, which is good for me. I only eat about 1,800 calories a day, which is kind of like the bare minimum for an adult male. And it takes doing that kind of like extreme diet to lose any type of weight. It's crazy, like I've really had to work hard to work against the medication to lose the weight, or to keep it off. And because it's quick, it makes your metabolism slow down tremendously. I mean, my metabolism would slow down naturally as I age, of course, but this was different. This was like I put on 10 pounds in a little under a month, and I was just eating I was eating hospital food. So for that month, and then all of a sudden I was 10 pounds heavier. So it's taken me about a month and a half to get rid of that excess weight. And now I'm kind of moving on to body weight that I was putting on before the medication. I don't feel bad, but I feel like it's one of those moments where I had to make a change in my life. I have to really focus on my diet, or else I'll start ballooning up with no control. And that's, I think, a direct result of being on medication. So also with the medication, there is a tendency to develop what's called tardive dyskinesia, and it's basically when you it's basically uncontrolled body movements. Like if you ever saw like Hunter S. Thompson when he has this, jerking body movements. Well, antipsychotics react or act on your dopamine receptors, and so where there is dopamine receptors, there is your mood, but you're also movement. And so you really have to, that's really why they have this type of reaction. And some people, like I'll have a tightness in my jaw. Some people will have it really bad where they can't, they can't unlock their jaw, or they will have very hard, very uncomfortable. They'll grind their teeth, and all their teeth will be gone in a couple years. it's really difficult to describe the effects of, or the pyramidal effects of antipsychotics, on because you have so many symptoms related with schizophrenia. It's hard to differentiate what's or what's the symptom of the medication, or what's the symptom of the psychosis, and like I'll have like dizzy spells, and I think that's the medication, but I'll also have, this repetitive movement, and that's my disease, so even though that maybe the medication will give me some restlessness, the fact that I'm pacing is my disease. I had the pacing before I was on medication, and I was pacing when I was in that psychosis, the last psychosis in it, and it was it's very difficult to even sit down. I have to, I'm working on using timers today to measure, to say, okay, I'm going to sit for 25 minutes, and I'll put on a timer, and I will sit for that entire length of that timer, just to try to break myself of those habits, and to have control over my own body, and to feel like I have control over my own body. I think that's the best that I can do, is to learn how to train myself how to accomplish these tasks that are to bring me back closer to normalcy. Like, can I, if I can not pace, I can I can work on the things that are in my life, that are the symptoms that are in my life, from schizophrenia. Like, if I can take action on those things that are causing me issues, those symptoms, then I can work on the symptoms of schizophrenia, and that's huge for me. You know what I mean? To be able to not only to recognize that I have the symptoms that I'm going through, but to actually be like, okay, I recognize it, and I'm gonna try to figure out a plan to work on these symptoms and have goals. And so, if you have, if part of my schizophrenia is the negative symptoms of schizophrenia, and one of those symptoms is a lack of goals or a lack of motivation. And so if I can use those things to establish goals and work on the things, then I can make progress in my disease, in schizophrenia. And so that is the overarching goal. And and I have something in my mind that tells me that just doesn't make sense, even though I know it does, and or that it's worthless, that I'll never be able to obtain it. And so I think it's important enough to work towards that in my life, that I can, even if I saw no progress on that, then I would still continue to work for it. I believe that strongly enough. But I am seeing progress in it, and I am showing that I can follow and set to a set plan with schizophrenia. And this is huge for me, because like I've had a couple of psychotic breaks, and that last one was really, really bad. And so I'm trying really hard to rebuild my function, and my normalcy, my new normal. And I want it to be, I want it to be lacking in those 5 symptoms of schizophrenia, negative symptoms of schizophrenia. I want to build a life that's an antithesis to those 5 negative symptoms of schizophrenia. Like, I want to be more social, I want to be more outgoing, I want to have better control over my thoughts, I want to have better control over my goals and my actions, I want to be able to to not to have emotion, to show the correct emotion, and I want to be able to be there and be present through those emotions. And all of these are very difficult for me to do, just by nature of the disease that I have. But I can build a life now with the medication that I'm on, and to take care of the positive symptoms of schizophrenia, like the delusions, the hallucinations, and those things. I can't really work on those, those just sort of manifest. But if I have medication that allows me to have relief from those things, then I can work on these negative symptoms by using them as stepping stones themselves. And that's where I'm at today, and that's how I'm planning on staying, and that's how I'm planning on staying alive. They say that if you get diagnosed with schizophrenia, it takes away 20 years off of your life expectancy. Most people like me end up in not good places, but I'm going to do something different. I'm going to be something different, especially with my late diagnosis, or late help. I'm old, with schizophrenia, already, so I'm moving through it, and I'm trying to be as reinforce my neuroplasticity enough to continue to learn and to continue to thrive and to continue to survive. That's my overarching goal, is to work on the problems I have of schizophrenia so that I can continue to survive and thrive in my life. I can claw back where I have had social withdrawal. I can claw back where I've had, I can claw back my vocabulary. I can claw back my goal-directed behavior. I can claw back my actions. I have control over my actions today, whereas a few months ago I didn't. And so, these are all just things that have helped me do those things, and I'm putting them out into the world because if they've helped me, then they might help you. Like if you're having problems pacing, or if you're having problems with repetitive behavior, and you can become aware of that, try to set timers for yourself to stop that behavior, and maybe you can work on it. At least give yourself some relief from that repetitive behavior just for those moments. Like, for example, I'm sitting down right now to make these videos, and that's very important to me because I'm sitting down for X amount of time. And so I'm really, using, and it's a way for me to be more social. So I'm using all of these factors in order to build a life that I want for myself. Slowly but surely, I'm building upon smaller goals and building bigger goals based on those accomplishments in those smaller ones. And I think that's the way that we just have to live life. I think that's the way that life is for everybody, but they have, with schizophrenia, it's just having to, especially after psychotic episodes, is trying to rebuild piece by piece these things, and hoping for better days. The medication that I'm on is helping me be more secure in the goals that I have set won't be erased by these positive symptoms. And I'm hoping that through the medication, I don't have any more, of these psychotic breaks. And I can actually just continue to live my life. Even with the cognitive symptoms that I have now, I can do it. It's manageable. If I can work on these other things and not face the positive symptoms of schizophrenia, then I can at least have a life where I'm working on my problems, and I think that's all I can ask for at this point. And that's the new reality that I find myself in, and that's the types of problems that I find myself in is kind of accepting what is and changing the things that I can, and having the ability to have goal-directed behavior again is paramount for me. But yeah, again, I hope you have a good day, and if you're suffering from mental illness or not, or anything, I hope you find some comfort today. And if you like the content, please like and subscribe. Thank you very much.